Now, you mentioned a couple of things, and one of them is weight, postmenopausal weight gain. It's pretty hard to avoid that. If you, uh, does it help to lose the weight later, or if you've gained it, are you then in big trouble for all time? What's the thinking on weight loss?
Weight again, it's really thought that weight loss does. Weight loss is probably one of the things that helps you the most overall. It turns out that a lot of the things that you can do for breast cancer are great for you, for your quality of life. Well, depends how much you like to eat, I suppose. But again, it reduces your risk of heart disease, of diabetes, of breast cancer, and so on. And so all these things, I think, make a really big difference. And so the more you can do that, the better off you are, and it's not too late.
And apart from weight loss, if you didn't lose weight, even if you maintain your weight, exercise, does that do anything? And if it does,
yes.
How? What's the mechanism? Why is it exercise? What has it got to do with breast cancer?
Cantley here? Where's Dr. Cantley? No.
Maybe we'll save that.
There are pathways that respond to exercise. Lou, are you around somewhere? Do you want to talk about this? All right, thanks. Well, there is a pathway there's a very important pathway, another one of those circuits in the cell, or multiple circuits, that tell the cell when to grow or not, divide or not. And there are other pathways that when you exercise and have reduced energy stores in the cell, block this pathway. They turn it off. And that's associated with a lower risk of cancer. You can probably treat cancer that way with drugs that do that. I think for this audience, since he's the expert and I barely understand it myself, I think what you have to understand now that some of the growth circuits and circuits that get activated in cancer get repressed by exercise. Some of you may have heard of something called ATP, which is a cellular energy molecule. By reducing the ATP and by activating other molecules, you can reduce cell growth and you can reduce cancer, probably can reduce cancer risk. And what Lou might not want, there are possible data that drugs like metformin that is used to treat type 2 diabetes does this, activates this pathway, this inhibitory pathway, and may be associated with reduced cancer risk. This is data that will come out over the next 3 to 5 years, and I think we'll know a lot more about it then. But there is a physiologic, I guess the summary sentence ought to be, there's a physiologic basis now for why exercise would reduce cancer risk.
And is it the exercise itself? Are we talking about aerobic exercise, or is it some later effect of the exercise that you build muscle instead of fat? I mean, does it matter what kind of exercise? Is weightlifting versus running, or is it both?
Well, as an expert on all of those, I will tell you that I think it's the exercise. My guess is this is very, very complex, even for Cantley over there. But I would say what we understand a little bit about is the exercise itself. Having the increased muscle mass and changes in the liver are undoubtedly going to have effects as well. But what we understand now, what we think we're pointing toward, is the exercise itself.
And it doesn't have to be running, again, 30 to 40 minutes of walking 5 times a week is, and actually there are big studies that have shown that, in high-profile journals. So these are things that everyone can do and are good for you.